Hi, good afternoon. This is Lucy Andrews. I'm a nurse and the owner of At Your Service Home Care. Today we're going to talk about a question that I get asked all the time. How do I know my loved one may need home care? There's a few very distinct things that could help you make that decision and know when in fact your loved one needs help or maybe just a little safety check at home. The first are very obvious. Things like a recent hospitalization or a recent fall. These things warrant immediate follow-up at home in order to ensure that your loved one would be safe. Oftentimes, those are prescribed and ordered by your family physician. Some of these things we're going to go over today, and there's 3 specific things that may warrant further investigation on your part for your loved one. The first is memory issues, and I'm not talking about just remembering a stranger at the grocery store's name. I'm really talking about consistent memory loss. Things like, I don't know where the keys are, I don't know where the car is, I can't remember your name. If you're seeing a loved one that has a consistent increased change in their overall memory, this may warrant a time that you want to have your primary physician investigate a little bit further. The second one is decrease in activity. We know, and research shows us, how important activity is and staying active as we age, which can really help our longevity. So if you start to see subtle changes in your loved one's ability to move around, get up and out of chairs, get in and out of the car, or just have an overall lack of doing things, this may be another indicator for you that they might need a little encouragement and help at home. Activity is so important, so if you start to see this decline, it may be time to investigate getting some help for your loved one at home. The third one is decrease in physical care and personal appearance. Now you may think, who really cares about how someone looks? But the reality is oftentimes when we see someone looking more and more disheveled, or their clothes aren't clean, somebody that used to be fastidious about their hygiene, if that changes or decreases, it may be an indicator that something else is going on. So if you see a loved one that has no change in their clothing over several days, or they have lots of food that has been spilled on their clothing, or they may not be shaving, they may not have their hair combed. These things are also indicators that there might be something else going on. It could even be that you sense a body odor. Maybe they're not showering or getting in the tub. So this is a third indicator that you might look for something. So these are a few things that are subtle changes, but that may help you decide it's time to look at some in-home care. The first thing that I recommend is talking to your primary care provider or physician about the things you're noticing. The second is to have an in-home safety assessment done by a reputable home care agency. There are many where you live, and you can ask them to come and do a free in-home assessment so that they can really help you determine, does my parent really need care, and what level of care they may need. So I hope these tips have helped you, and I'll talk to you soon. Thanks again. It's Lucy Andrews signing off.